Hi, my name is Alicia, and welcome to Mess to Masterpiece. Today's topic is Ehlers-Danlos Syndrome. So, what in the world is Ehlers-Danlos Syndrome? And I didn't know either, so don't feel bad if you don't know. It's a pretty rare condition. It's 1 in 3,500 people have it, so pretty rare. And the other thing about Ehlers-Danlos is that there's 13 different subtypes, so everybody is unique. Even though I might have EDS, is what it's called for short, and somebody else does, we might have completely different symptoms. But basically, what is it? It's a hereditary disorder of the connective tissues. So at the gene level, there's some sort of fault, and whatever the fault is determines how it can affect how collagen is produced or how the collagen works with other proteins. And so that's the gist of what is happening. Symptoms for EDS can include joint hypermobility, which means that it moves beyond the normal range. So a lot of times they'll have you do a test to see if your thumb will bend back and touch your arm, which is cool. Mine does, which is kind of random, but joint instability and pain is another common symptom, and that can mean that there's a lot of dislocations that you have. It can pop out in place, or it can cause to have surgery, or there's a lot of associations with that effects. Neuropathy, scoliosis, stretchy skin is another symptom. Abnormal scarring, as well as weakness of the tissue parts that can lead to a specific death or illness. So again, for EDS, everyone is different, but what is the general prognosis? A lot of the times that it's not just a person doesn't just have EDS, it's multiple comorbidities with it, and those comorbidities can play a factor into the prognosis and death rate. A lot of the times, if there are any kind of organ or vessel rupture, that can significantly affect a person's life and their length of their life. But other people that have EDS are able to maintain somewhat normal lives with maybe modifications. For example, I know several people that in the beginning of their EDS, they were able to walk and move pretty freely, but now they require the use of a wheelchair. So it can change over time, and even in a season of a flare, it might be different. You might be able to walk one day and not walk the next. Also, PT is another way that is often used to try to strengthen the body. But with treating EDS, as with any other condition, it's really important to have a comprehensive approach. And so it's not just one organ system that's affected. It affects every part of the body. So if you are experiencing some of these symptoms or think that you might have EDS or know of somebody who does have EDS, just keep in mind that everybody is different, and also the need to have a doctor that was looking comprehensively and seeing how all the pieces fit together and how one thing affects another. It's like a domino effect, unfortunately. So that's for EDS.